Namaskar, I am Dr Namita Singh, registered consult psychologist under RCI working at Apollo Hospitals, Hyderabad. Today I will be talking about the myths related around bipolar disorder. Bipolar disorder is a psychiatric condition in which there are rapid to slow mood changes and there is different symptomatology depending on various factors. Today we are focusing on many of the myths which people have gathered over this condition. This is partially untrue. There are three types of subtypes of bipolar disorder. Bipolar 1, in which there is a high euphoric state, a mania state, with hypomania, a lesser excitatory state, and then major depression. It can last from 1 week to few weeks in terms of cycles. Then there is bipolar 2, in which there is hypomania. Hypomania means lesser agitation, lesser high manic state, and major depression. Then there is the cyclothymic disorder, in which there are minor hypomaniac state and depressive episodes. On and off, the cycle keeps on repeating over a few weeks duration. It's a big myth. People are not just moody, they have actual deficits in the neural circuit and the biochemicals in the brain are altered. Due to that, they can be highly agitated, highly excited, having robust energy continuously, and they can be very sad to that extent that sometimes they may think an executable plan for self-harm and suicide. That is a big myth. Exercise and good nutrition can help in recovery, but adequate medication, supportive psychotherapy, relearning the problem coping skills, relearning basic communications as anger management, group intervention can be altogether a complete package to come out of the state. But medication is important, psychotherapy is supportively very important. It's a big myth. Never on your own stop the medication. The psychiatrist, the treating clinician is the best person to decide how, when, and over a what period of time medication can be stopped. Sudden stopping can result into relapse and complex behavior situation. This is again a big myth. If with medication the brain is more calmer, in a more zen state, the creativity, the divergent thinking flourishes better. So if any artist, performing person has bipolar disorder, it is important to take medication and your performance, your creativity will increase for a better aptitude performance. It's a myth. It's like they go through severe, strong, fast roller coasters of highs and low. I equate an example as their mood state is suddenly into climbing like a cliff and then getting down into a deep valley. So these roller coasters are sometimes very harmful, and it can lead into impulsive behavior reaction. Sometimes to control these mood state, these individuals are more addicted to substance abuse, which can lead into self-harm behavior or for pleasure's sake taking high risk decisions. This is a big myth. medication depends upon the duration, state of the illness, disorder, age factor, coexisting other morbidities, and the overall functioning status of the patient. Many times in clinical practice we have seen that to calm themselves down, many bipolar disorder patients, individuals do get addicted to substances, and that time the medication may not work at all. So it is important that they express the behavioral problems to the clinician, and the doses and medication would be decided accordingly. So overall, like other medical condition, bipolar disorder also can be managed, treated, and preventive methods developed by an individual. It is important to have a correct diagnosis, have the acceptance towards the disorder, and seek out professional help in time. Many times we have seen, and research all over, the clinical research all over the world has indicated that bipolar disorder patients are at a very higher risk of committing self-harm in the form of suicide and heavy risk-taking behavior. 10 to 20% people with bipolar disorder many times commit suicide or attempt suicide. So if medical treatment and supportive treatments are done in a holistic way, the person can be symptom free and have a comfortable, easy life. Take care of yourself, stay healthy, and reach out to professionals. We are always there to help you, support you, and give a better quality of life. Thank you. Namaskar.